Well, CAR T cells are an immune therapy. So this is a procedure where we collect the patient's white blood cells, specifically their lymphocytes. We modify those lymphocytes. We reprogram them and put in a signal for them to fight the lymphoma. We grow up an army of these lymphoma-fighting CAR T cells in the lab. We give the patient a little bit of chemotherapy, 3 days of gentle chemotherapy to have their immune system kind of calm and out of the way and let the CAR T cells do their thing. And then we reinfuse the CAR T cells into the patient. CAR T cells go inside the body. They will travel to where the lymphoma is and go fight the lymphoma. And a special kind of feature of these CAR T cells is that they're basically an army that expands the number of soldiers when they find the lymphoma. So when they go, we start off with, let's say, 200 million of these CAR T cells. They'll swim to the site of the lymphoma and go start fighting the lymphoma. And then the army expands. The CAR T cells expand and grow as they're seeing the lymphoma. The side effects of CAR T cells are a little different than what we might expect with a stem cell transplant. This is really side effects related to the immune system being activated. So fevers, heart rate goes up, blood pressure can go down. A patient can have confusion. And that's different than what we see with a stem cell transplant. So in a stem cell transplant, particularly autologous stem cell transplant, which is what we typically use for lymphoma, it's really, a patient we collect the patient's stem cells, but really the treatment for the lymphoma is high-dose chemotherapy. So we give a week of high-dose chemotherapy to try to kill every last cancer cell in a patient's body. After the chemotherapy is done, we reinfuse the stem cells, and the stem cells are really just being used. They go into the body, they go to the bone marrow, they repopulate the bone marrow and reinitiate blood cell production to lower the amount of time that a patient's blood counts are low after high-dose chemotherapy. And that makes the procedure safe. Patients' side effects that they experience during autologous stem cell transplant really are the side effects of the chemotherapy. Tiredness, decreased appetite, nausea, diarrhea, and the period of time that they experience those side effects is shorter because we've reinfused the patient's stem cells. Rarely a patient could receive an allogeneic stem cell transplant with lymphoma. We don't use these all that often, but it is a procedure that we use sometimes. These are donor stem cell transplants. That's a combination of chemotherapy, sometimes radiation, and instead of a patient's own stem cells, we use donor stem cells. And in that case, it's a combination of the chemotherapy and or radiation that we use, as well as the new donor immune system that can help fight the lymphoma for the patient.